Right. Hello, everyone. My name's Jay. I'm a registered nurse. I have my associate's degree in the applied science of nursing. I also have my CCRN from the American Association of Critical Care Nurses. I've been a nurse in medical ICU for about 2.5, almost 3 years. And today I will be talking about acid base balance. So, this presentation is going to review, it's just going to be a basic overview of acid base balance. We're going to cover the pH scale, ABG values, the major organs that are involved, the chemistry, and general nursing management. I'm not going to go in and break down the difference between respiratory acidosis and alkalosis or metabolic acidosis alkalosis because this presentation would be too long for that. But it's just going to be a general overview of what um, acid base balance is and how that is in the body. So let's get into it. All right. The human body is a complex biological structure that is composed of numerous structures and cells. Every second, millions of chemical interactions occur, both localized and systemic. Every component of your body works together to maintain the perfect internal life sustaining environment defined as homeostasis. So, that's a term that we're all pretty familiar with. Every organ wants to be happy and basically carry out its own function or functions in an ideal environment. So, for the organs to properly function, they require a constant supply of nutrients, a constant transportation of products, and a constant clearance of their waste. This task is facilitated by blood vessels, the cardiovascular system, if you will. Blood vessels transport vital nutrients, minerals like sodium, potassium, chloride, chemical messengers. So, your endorphins, all that other jazz, catecholamines, gases. Blood vessels also transport immune cells, etc. All that to your organs and tissues in a continuous manner. So, if an organ is damaged or distressed, the delicate balance of blood acidity can be altered. This creates kind of like a spiral effect that can affect the rest of the organ systems in your body. So, blood acidity affects homeostasis. Acid base balances usually indicate problems with the specific organs or body systems, like I just said. So, usually that's like the lungs, diaphragm, maybe the muscle the diaphragm's injured, and that's what's affecting the lungs, not necessarily a disease process in the lungs themselves. Your GI tract, kidneys, and basically any other system can kind of cause acid base balance issues. So, prompt diagnosis and proper treatment is imperative to preventing the spiral effect or from letting the acid base balance get out of whack too much. All right, a quick term review. So, acid and base, these are defined as like scientific chemistry. It's technically a lot more than this, but for this lecture, these I like these definitions a lot more. So, an acid is defined as a substance that gives off hydrogen ions in water. A base is a substance that can accept hydrogen ions in water and can neutralize an acid. Homeostasis is defined as a state of balance among all the body systems needed for the body to survive and function correctly. So, this includes fluid status, your vital signs, you want those to be stable, obviously, electrolytes, and of course, the acidity of your blood. Metabolism is defined as the chemical changes that take place in a cell or an organism. So, basically, energy production. So, your food, the water, energy regulation, and any compensatory actions or mechanisms. The pH scale. The pH scale is a measure of the concentration of hydrogen ions, the acidity or alkalinity of a solution. So, the more hydrogen ions given in a present solution means that it's more acidic. The less readily available hydrogen ions in a solution means that that solution is more basic. Why is that? So let's go back. Let me throw another term at you, curveball. What is a solution? So a solution is defined as a homogeneous mixture where one substance, the solute, is evenly distributed throughout another substance, the solvent, creating a single uniform phase, meaning the components cannot be visually distinguished from each other. So in science class, you pour like a glass of salt or sugar into water and you mix it, and then all of a sudden the water basically looks the same, but certainly doesn't taste the same. You can't, everything kind of dissolves into that solution to make it a uniform solution. There's no floaty bits or anything in there. So blood is very similar to that. It is a solution. For acidic solutions, so high hydrogen ions concentration. Hydrogen it likes to bind to a lot of things. So if there's a high concentration of hydrogen ions, that usually means that there's a high lot of reaction going on in that solution. So there's a lot of free hydrogen ions going on because whatever substance has held onto those hydrogen ions, they're now broken apart and the hydrogen's just all floating around and they're ready to react to any other substance. On the contrary, a basic solution isn't going to have as much floating around hydrogen ions because they're already bound to the original chemical substance, whatever that is in that solution. So back to our blood vessels and homeostasis. Again, blood is a solution. It transports nutrients, the waste products, byproducts, all of the above, and its acidity is constantly changing, and it has very little say in what substances are dumped into it. So the kidneys filter out the blood. That's the main one that we're going to get into about acid-base balance. That's a big player. And our lungs, carbon dioxide and oxygen exchange. That's constantly going in and out of the blood as well. So these solutes that are in the blood all alter the acidity, and when left unchecked, they can cause severe distress and even death in patients if they go too far unchecked. So if a patient's blood is too acidic or if it's too alkalotic, the normal chemical reactions and cellular functions can break down and overall just stop, depending on how dramatic the change is. So a quick overview of ABG results. So you can see on the slide, in the right side of the slide, I have ABG values. So the pH, a normal blood pH is 7.35 to 7.45. Now, on the visual that I said right there, showing that pH of blood is 8, but that's not true. It's kind of between the two. So the 7.35, I have it highlighted as red because it's more acidic. That's how I remember it. I like color coding things. And more alkalotic is 7.45. Now CO2, you see the colors are reversed. Now, why is that? Why is 35 the lower number, CO2 up to 45? Why is higher? Well, carbon dioxide is acidic. So if there's a higher level of carbon dioxide in the blood, that means my blood pH is going to go lower. If my CO2 level in my blood is low, my pH is going to be higher. It's going to be more alkalotic. So kind of like an inverse of what one might normally think. Now bicarb, normal levels in the blood are 22. So if I have a low bicarb level, bicarbonate is basic. I'm not going to, my blood's going to be more acidic because there's less base in the blood. And 226, so anything above 26, that means there's more base of bicarbonate in the blood. All right, the chemistry. So I'm going to go kind of quick on this. We'll cover it more later. So acids and bases, that's what acidity, alkalinity. The body likes a 20-to-1 base acid ratio. I kind of have the slide switched or whatever for whatever. It's fine. 20 is the base, 20 base to 1 acid is the ratio that the body is comfortable with and would like to stay in. It's a big comfy environment with that ratio. So what are our acids? Our acids are hydrogen ions. Carbon dioxide, that's a big main one for these ABGs. Carbonic acid, which is H2CO3, and ketones. So patients in DKA, diabetic ketoacidosis, that can be another main source of acidity. So metabolic acidosis for that. We're just going to, and then our bases, the main one is bicarbonate. So the chemical structures are on the bottom. I like chemistry and I like visualizing stuff, so that's just reference. We'll see how this kind of what these molecules do and how they're related in the bloodstream in the next slides. The main organs that are involved in acid-base regulation are your respiratory, so your lungs, and the kidneys, our renal system, GI, gastrointestinal, stomach acid. That plays a role. Neuro, so if your nerves aren't firing right to the right places, aren't telling your lungs what to do properly, obviously that's going to affect your acid-base balance because it's going to be a lung problem, but might be neurogenic in origin. Cardiac, not getting enough circulation. Endocrine, something's wrong with your endocrine glands, your catecholamines, something like that. But generally, the main two are your lungs and your kidneys. So lungs, we can breathe really fast. I can breathe deep if I'm thinking about it, or I can hyperventilate, like shallow breathe in. That is the quickest response that your body has to find these acid-base imbalances. So obviously, we breathe in oxygen, breathe out carbon dioxide. Carbon dioxide is a main byproduct or waste product, rather, for cellular respiration. So once our bodies use up the oxygen, we need to get rid of the carbon dioxide, which is that byproduct, that waste product. Carbon dioxide levels can be changed within minutes. That's our main acid that we can breathe out. So I can increase how much I'm breathing, hyperventilate. That breathing faster, I'm going to breathe out more CO2. I'm going to breathe it out faster. So I'm going to lower the carbon dioxide levels in my blood, and that should alter the acidity in my blood. That should lower my pH. I should see a downtrend in my carbon dioxide. Now, what's wrong with this? What's the catch? The catch is that your diaphragm can only take so much. So your diaphragm tires out, you're breathing too much, you're breathing fast. Think of you're running a marathon or whatever, and you don't train for it. Your lungs tire out. You get very tired. You're not used to it. So it's great. It's a stopgap measure though. So your lungs are going to tire out, and when your lungs tire out, then you're kind of screwed. So that's where renal system comes in, our kidneys. So our kidneys manage the hydrogen and bicarb. So the kidneys either hold onto hydrogen or bicarb, or they can excrete it. Fluid status as well. And of course, our kidneys regulate our potassium or electrolytes. So, but the catch with the renal system, which it's good long term, awesome, it can stay functioning a lot more, but it takes days generally to make a difference. You usually don't see a big change in renal renal labs, any metabolic difference or compensation for at least like 1, 2, potentially even 3 days. So hopefully the acid-base balance isn't bad enough that you're tiring out your respiratory muscles too quickly. So here's a kind of crude sketch that I spent like 40 minutes trying to create, but this will just kind of shows the process of from cellular respiration to excretion or exhalation of our bases. So from the cell. So our cell produces cellular respiration, Krebs cycle, blah, 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 all that fancy stuff that I don't really remember from biology, chemistry, but don't tell anyone I said that. So a byproduct from that, the one that we're concerned about right now, is carbon dioxide, and that enters the bloodstream from the cells into the bloodstream. In the bloodstream, there's a lot of free-flowing water. Drink your water because it's important. So that carbon dioxide molecule is going to find and bind loosely to the hydrogen molecule. So, you exhale underneath water, there's a lot of bubbles. So carbon dioxide is like very, very hydrophobic. It does not like staying to water. So it's a weak acid. So when carbon dioxide enters the bloodstream, finds water molecule, it will combine to create the weak acid carbonic acid. This is H2CO3, as you can see in the arrow right there. That is going to enter the bloodstream. Well, it's going to be in the bloodstream, and it can very easily break apart. So what happens when it breaks apart? There's going to be free hydrogen ions. So, free hydrogen ions, a lot of hydrogen ions. Acidity. Our blood's going to be more acidic. So normally this happens all the time. This is pretty normal. It's a weak acid. Some of the carbonic acid stays intact in the lungs, breathes out. Then we have an extra hydrogen ion, and we have an extra oxygen molecule that we're holding on to. Now, if it breaks apart, if the carbonic acid breaks apart before it reaches the lungs, we have hydrogen ions and we have bicarbonate, which I think we're a lot more familiar with. So this is filtered out by the kidneys. So kidneys can, again, filter out the base, which is the base, which is bicarbonate, or an acid for the extra hydrogen ions that are in our body. So it's a delicate balance, again, between hydrogen ions. They're very important because, as you can see, hydrogen, except for carbon dioxide, they are essential, and they're a big component of like H2O, of water, hydrogen's present, carbonic acid, hydrogen's present, and bicarbonate, hydrogen present there. So this hydrogen that we're excreting is free hydrogen ions that we no longer need if our body doesn't need any. But we might need it to retain some so that we can make more chemical reactions, other stuff like that. So that's kind of, that's it. So you can see at the top, just follow the diagram across. The top's like very zoomed in on the alveoli. Oxygen exchanged across the capillary membrane there, oxygen, carbon dioxide, and that's breathed out to the lungs. So the top's a zoomed in picture of the lungs, basically. And kidneys, kidney's a kidney, bicarb, and our hydrogen ions. General nursing management. So what do I, as a nurse, taking care of a patient with some sort of acid-base balance, not going to be particular here, what do I want to look for? So first, I want to get my vitals. If I'm getting someone, no matter what I'm admitting, I'm like, hey, are they conscious? That's the first thing. I'm getting a report for whoever's coming up, giving me the patient, assuming that they know something about the patient, hopefully. Emergency department, I'm looking at you. Just kidding. But I want, are they conscious? And all right, I'm going to hook them up to the monitor. What are my vital signs? So I want to check respiration rate. Are they tachypneic? Are they bradypneic? Are they breathing too fast? Not breathing enough. That's going to tell me a lot of my CO2. Am I retaining carbon dioxide? That's going to be bradypnea, low breathing. Or am I hyperventilating? Big, deep breaths. Small respirations. Am I breathing out a lot of carbon dioxide? That is a big tell sign of diabetic ketoacidosis, or just respiratory acidosis in general. You're trying to breathe off a lot of carbon dioxide. That is the main thing that I'm looking for acid-base balance, because again, lungs, that's going to be the first thing, that's going to be our first sign of distress, is our lungs. Also, my O2 sats. What am I satting? Am I on oxygen? Because if I'm not satting well, maybe we're like respiratory distress. Our diaphragm might be giving out, depending on how long our patient's been breathing fast and all that. So that's another important thing. Heart rate. Are we in stress? Are we dehydrated? Let's look at our EKG. Get them on telemetry. Are we having peak T waves? Are we hyperkalemic? Like what's going on with kidneys, all that other stuff as well, and blood pressure. If we're super acidic, what did I say? That's main thing is your patients are gonna be acidic. That's gonna be the main problem. I'm more worried about a patient with a pH of 7.1, 7.2. Lowest I've ever seen is 6.4 with a pulse. Anyway, but 7.1, I'm going to be more concerned about that than a pH of 7.5. Usually, that's not, if they're alcoholic, it's not above 7.47, it's kind of like, that's kind of, if I see that in ABG, I'm an ICU nurse, so very little phases me. But I'm not going to be as worried as a pH, again, of 7.1, 7.2, but look at your patient. All of that to say, acidity is going to be the main thing I'm concerned about, because when we have a high acid level in the blood, basic chemical processes break down in the blood. Again, if me being ICU nurse by trade, if we're maxed on vasopressors and my blood pressure is dipping, I'm going to be like, okay, why is my blood pressure? I'm going up on all these vasopressors, but the blood pressure is not responding. First, is your line connected? But second, let me get an ABG. What is our pH? Because if our pH is 6.9, that's really, really bad. And just what is our pH? Because if our pH is super high, the medications can't work because they break down. Like, free hydrogen ions, they want to bind to everything. If I have a lot of hydrogen ions, super acidic solution, my medications are going to break down before they get to the receptor sites that they need, alpha and beta receptor sites that they need to react to. So what am I going to give? Probably a push of bicarbonate. That's if you're ever in a code situation. It's not part of ACL's algorithm, but sodium bicarbonate we usually give in codes or near code situations and stuff. And sometimes all of a sudden we give bicarb, whoa, we have ROSC, because the bicarb, we're giving a big base, hopefully trying to catch up all those extra hydrogen ions and trying to create a buffer so our meds can work and our body can actually, process the way that it's supposed to. Labs. So ABG, BBG, I already said. BMP, I want to know what's going on with my electrolytes, what's going on with my kidneys. Are they working? Are they going to kick in? Do they have the function to kick in, even though it's going to take a few days? Do we need dialysis if that's our main issue? If we're metabolic acidosis, if our kidneys aren't filtering our blood right, that might be our solution. We always want to treat the cause, not the symptoms. Again, breathing characteristics, I already covered that. Mentation, ANO, do they know what's going on? Urine output, again, kidneys, what does the urine look like? Oh, I said urinalysis as well. Urinalysis, ketones, see if we're in DKA. Muscle weakness, cramps, spasms, electrolytes, all that other stuff as well. So kidneys. So interventions, I already said EKG, telemetry, oxygen if they need it. Don't want to get them too high though, especially watch people with COPD. Monitor labs. I'm going to watch the fluids, hyper or isotonic bicarbonate drips. Again, if we're super acidotic, bicarb drip. Get Nephron early, nephrology. They're really good at managing the fluids. And antiemetics, because I don't want my patients throwing up a lot. They're throwing up just like stomach acid. That's going to alter pH as well. Bronchodilators, open up those airways to increase gas exchange. Diuretics, especially Diamox. Diamox, that is a special diuretic that actually helps. I believe it retains more bicarb, if I'm not mistaken off the top of my head. Of course, I just forgot everything. But Diamox we usually get that for acidosis, and that's a very particular drug. And again, dialysis. All right, so now getting more into like the project side of this. I forgot to say in my introductory slide, but I like presenting it like it was actually part of what the project's supposed to be. But my project I chose was creating for an associate degree undergrad program, nursing program, teaching like a lecture on acid-base balance. So what I'd like to incorporate to help increase like education and learning stuff from this presentation would be to incorporate active learning. I like using like real life scenarios, as I kind of used in my slides previously. I like to use real world examples and engage the students in the learning. So group discussions, peer teaching. So I'd like to divide the class into like 4 groups, depending on the size, of course. Assign each group an acid-base disorder, and have the groups collaborate to create a presentation and present their topic to the class. So active learning strategies increase engagement and promote critical thinking. So from the presentation that I just gave, I'd kind of like to engage their critical thinking, have them, I'm just like, all right, acid-base balance, lungs, kidneys. Which one is which? These are the parameters. What do you think is higher? What one do you think's lower for ABG? What do you think would be higher and lower? What would the ABG results be for your assigned acid-base disorder? So that kind of just giving them the foundation and then kind of challenging them to kind of teach me or see if they could put two and two together and figure out their acid-base disorder and teach it to the class, and then can fill in from there any gaps that they might have. Action step number 2, simulation. I like simulations, simulate the care environment, what's actually going on, hands-on stuff. So I would simulate a respiratory acidosis, primary to opioid overdose, secondary to sepsis, just to throw in everything in the mix. So this is kind of like depending on how advanced these students are, I would, if it was beginning fundamental, second semester ABG, interpretation or education, second semester nursing school students, I think that's when I learned about ABGs. The first time in nursing school, I would probably just do respiratory acidosis, primary to opioid overdose, tie those in. But I know we reintroduced ABGs in my second to last and last semester of nursing school. I would like to throw in the sepsis as well, because that gets, the septic shock element, and that acidosis related to that as well. Just to kind of get the brains turning and stuff. But anyway, students would carry out the assessment and treatment of the patient, identify priorities, probably do a little pre-lab assignment, just to kind of get them familiar with what they might be seeing and what treatment options we have available. Practical skills, head-to-toe assessment, oxygen administration, Narcan, IV antibiotics. So if I threw the sepsis in as well, we get at least that skill in the simulation as well. And just kind of help solidify the students' understanding of concepts through the application of teaching and merging book lecture knowledge with learned practical skills. So hands-on, I think, is one of the best ways to learn. At least that's one of my favorite ways to learn. Collaboration to get IPE, interprofessional education. I think that's what the term is nowadays. But just collaborate to bring more people into the mix and get other professionals input and take on certain education topics, ABGs. So respiratory therapists would be really, really good for this. If my alleged program had a respiratory therapy program, I'd love to bring them into the simulation lab. Maybe they could try intubation skill if that's a skill that they're working on, or they could manage the airway, and they could give insight. Them and their instructors could give more insight on the lungs function and ABG, respiratory acidosis, since they are the lung specialists there. Nephrology or pulmonology nurse practitioner, be a good advanced practice nurse to collaborate with. Also, we could use physicians as well, but for nursing education, kind of good to just kind of see what you as a nurse can branch out into. Also, certified registered nurse anesthetists. They deal a lot with ABGs, acid-base balance, since they're area manager and basically the guardian angel, as I like to think of it, of patients during surgery, whether they're undergoing anesthetic. If it's general anesthesia, then it's a lot more, it's airway management and being their lungs, since their lungs are and their diaphragm are kind of put out of commission for the surgery. So some good resources that we can use and collaborate with this education. The resources that I would need for this presentation would be campus facilities, simulation and laboratory equipment, facilities, obviously lab equipment, whether that be IV start kits, potentially IV piggyback, IV channels, mannequins, all that stuff. Interdisciplinary student education. So I need like access to RT students, RTs, AP, advanced practice nursing programs if they want, if my hypothetical college had a nurse practitioner program, be great to bring them into that as well. And any other specialties, partnered and affiliated healthcare systems. The one that I am spoiled. I've always been Mercy College and always I love Mercy. So I did my associate's program there, and they're partnered with Bon Secours Mercy Health. So have a lot of clinical connections and job opportunities. So being partnered with a healthcare professional would be great for sharing resources and assisting with financial aspects of the education, and professional organizations that we could also use for educational resources: the American Association of Critical Care Nurses, AACN, American Nephrology Nurses Association, and the National Board of Respiratory Care, which is more for respiratory therapists, but can also be a good resource. American Lung Association is another one off the top of my head, and the American Anesthesia Nurses Association. I forgot what the abbreviation for that one is, but there would be another good resource as well. In conclusion, so acid-base balance is an essential component to undergraduate nursing education. It's and you go more in depth the more specialized you go. So like ICU it's all acid base, honestly. And this project has really helped me like actually see how important that really is, because I do it kind of like subconsciously nowadays. But acid base is really, really essential, since the blood is basically the highways to getting transport nutrients, waste products, all of the above, to and out your body for the most part. Students will comprehend advanced concepts through multifaceted learning methods and strategies that I will implement in this education and this presentation. Interdisciplinary simulation and professional consultation will foster a healthy and engaging learning environment. Again, getting other professionals and other specialties collaborating in this education. And finally, establishing and maintenance of current organizational partnerships will provide necessary resources for educational endeavors. Just good clinical partners for the most part. Make sure we have that good, sweet college funding so that we can have good programs and good educational opportunities for prospective students. All right. If anyone has any questions, they could ask them now. Also, fill out the survey that I will link or comment in for just feedback on the presentation. Thank you guys for listening.